Hello and welcome to A Couple of Radiology Gurus. I am Chandria, and yes, a couple of radiology gurus, and it's only one. I know, yes, I can count. This is going to be my tale of radiology today. The other radiology guru will be joining us later, so to tell his side of his radiology experience. And we're going to come to you, and we're going to do one where we're next to each other, but I want to say hello to everyone, and I'm so happy to be here. Just to tell you a little bit about me, I am a radiologic technologist. That is what I went to school for. I actually went to Emory University Medical School for my degree. I started out in X-ray, and I did it in school. That was the only time I did X-ray, so don't ask me how to shoot. I can still shoot X-rays, though. I can still shoot an X-ray if I had to, but don't ask me to. I really can't help you, especially don't send me to the OR. That's what the other radiology guru is going to talk about, because I know nothing about that stuff. If you check my TikTok out, I've got a TikTok on that, and it's pretty funny. So click the link, go on over to my TikTok, check out the videos. I try to entertain and educate at the same time. So yes, I am a registered radiologic technologist. I actually do CT, CAT scan, as some people call it, MRI, magnetic resonance imaging. I am licensed and certified in all three. I am also licensed in mammography. I don't do it yet. Hold up. I do not do mammography. Yeah, a lot of heavy lifting in that. Yeah, I don't do mammography. Hats off to all the mammo techs. You deserve every penny you get. Every penny you get. Anyway, so that's a whole nother story in itself. I did a little bit of mammo out in Las Vegas. I will come to you with a story time on that because it's actually kind of funny. Yeah, it's hilarious. But anyway, so I did those three modalities, and yes, I can still do all three. I'm just not registered in them. I can do mammo, I just don't want to. So I will say four. In MRI, the reason I got the mammo certification, I did not want to be a mammographer. I did not do it to do those exams. I did it because in MRI, we also do breast exams in MRI as well. So it helps me on that end because I was going in a different direction, more focused on breast MRIs because it was starting to really take off, and I really wanted to kind of move in that direction and be certified and know exactly what I'm doing and understand all the breast side of it. So yeah, I got all I needed, and I'm good on that. Yeah. So that's the story time in itself. But just a little bit about me. That is what I do in radiology. Now I am a college professor in MRI. I teach MRI. I teach adults how to become certified in MRI. So that's pretty. And the other thing that I've done is research. Yes, most people think we just press buttons. No, we do not just press buttons. We actually know more than pressing buttons, you guys. We do a lot of physics, a lot of thinking outside of the box. You just cannot just walk in and shoot an X-ray. It just doesn't happen that way. So, I've done research, mainly brain research is what I did for about 5 or 6 years. 5 or 6 years. I loved it. I never thought that I would love it. Just like I didn't think I would like teaching. But I like teaching. I enjoy it. I've always worked at teaching hospitals. So I enjoy the teaching aspect, but I didn't think I would ever want to be in a classroom setting, but I love that. So I'll go into that as we break down our channel and do more recording. You will get regular recordings. We are going to devote all of our time and resources to sharing with you all about our experience in the field of radiology, which we both love. And I'll wait till the other guru gets here because people want to know, did you meet your husband in radiology? Is that how you guys connected? Was it a ER? What are some of the other hospital shows? I don't watch them because they're never correct. We're going to talk about that too because my husband and I watch those shows sometimes and we're like, that's not even a CAT scan machine. It's not even an MRI machine. That X-ray is not even an X-ray. It's a CAT scan. Oh my goodness. So, medical people pick out all types of things in the hospital shows. So a lot of them are inaccurate, you guys. Totally inaccurate. And let me tell you, if you're coming to get an MRI, do not watch any hospital shows. Don't watch them because they're just gonna scare you. And then we gotta reschedule your test, or it's just not gonna be fun. So don't believe any of those things. The MRI test is nothing like the TV shows. Okay. I have a TikTok on that too. It's pretty funny. You might want to watch that too. Let me know in the comments when you go over to TikTok and check that video out. I think it's rather funny. I try to be funny. Actually, I'm just myself, but there are so many funny tales in the 20 years that I've been doing radiology. Yeah, 20 years. Time goes by very fast. And so we're going to talk about on our channel, what are some of the craziest things we've seen? What are some of the funniest things? What do we like best? What do we like least? And any questions you all have, please put them in the comments. We would love to be able to answer the questions that we can answer. Co-workers, we're going to talk about that too, because that's rather entertaining. We're going to talk about which modality has the friendliest technologies and which ones have the crappiest technologies. So we're going to talk about that because, hey, every job has like those type of people that, they're great to work with or they're not. So we'll break it down on some of the modalities. So how did I get into radiology? Well, that was not my first choice. I was not planning on being in radiology, actually. Yeah. I started out, my mother wanted me to be a nurse because I have aunts and everyone that are nurses. And I was like, I don't want to be a nurse because the only thing I knew about nursing was like cleaning people and wiping them up and bedside. And I was not interested in that in the least. Yeah, no, it wasn't my thing. But I love patients and I love science. So I thought I wanted to be a respiratory therapist because my mom's best friend, she was a respiratory therapist and she never went to work. And I'm like, how does this lady never go to work? She lived a very comfortable life. She enjoyed herself. She traveled a lot and she retired like at a young age. So I was like, Well, it turns out she only worked Saturday and Sunday. And then sometimes she switched it, but 2 nights straight. 24, but it really wasn't 24. They call it Baylor Shift. So she would do that, and that was her hours. I was like, that's right up my alley. I love that. Well, radiology had that too. So I started in respiratory, but hold up. I only lasted a week. And I wasn't even in the program yet. Yes, I was not in the program yet. I was just like shadowing. And we were in the section, a neonate section, and this baby coded. And the baby was probably the size of my hand, like from here to the tips of my fingers. Like the baby was so tiny. I could see through the baby. And they had to, put the breathing tube down. It was the most shocking thing I had ever seen because the baby was so delicate. And I just couldn't take it. I fell out on the floor. Yeah, they had to attend to me after they got the baby settled. And I couldn't take the gurgling of the mucus. I can't take mucus sounds. I don't like mucus sounds. Yeah, even to this day, I just, not my thing. So after that, I still floated another day with them. I lasted about a week and they were cleaning out somebody's trach. And I was like, about to throw up every time. And I said, I cannot do this as a profession and want to vomit I couldn't take the smell of the mucus. It was just bad. It was bad. I'm not going to get graphic, but it was bad. Wasn't for me. So I had invested all of this time getting all my prereqs and all of this stuff. And I was like, I'm not getting any younger. I was in my 20s at this time. So I'm like, I got to do something. Well, I got really, really sick after backpacking through Europe with my friends. I was the only one that got super, super sick, had to be hospitalized. So, when you go to school for medical stuff, if you miss a semester, miss things, you got to wait the next year to get into the program. Well, that's what happened. Well, I moved back home from North Carolina and I was like, what am I going to do? Oh no, my uncle, who is the director of the hospital in radiology, he was like, go for radiology. You can work that same Baylor. We have Baylor too. You can do 2 days on and then you're off for the rest of the other days. And you can do that. And I'm like, oh yeah, okay. I really didn't want to do radiology, but I'm like, as long as I can get that schedule and school is not 10, 20 years, I'm okay. And I don't come out of school with a lot of debt. That was my main thing. I did not want to go to school and have a lot of debt. I had friends going to school to be physician's assistants, doctors, some of my family going to school to be lawyers, and they had astronomical debt when they got out. And they didn't make any more money than the people that I knew who went to school for 2 years and 4 years. So I like to travel. That's my thing. I just want to do what I need to do so I can travel. I love to travel. So I got well, and I started applying to schools because a year had gone by and I still needed like a chemistry or something. They did something, some kind of math or science. So I got those done, went back to school, got those done. And I applied to every school in my state, and only 2 accepted me because they were taking everybody straight out of high school, and I wasn't straight out of high school. So I was like, oh no. And the one I really wanted to get into, did they respond? But either way, I didn't get in. So Emory University Medical School accepted me, and so did Atlanta Medical. They were the only 2 schools that accepted me out of all the schools, almost in the whole state. And back then, there were not a lot of schools teaching radiology. It was a small group. Now there are a lot of schools. Things are online. It was not like that. I'm telling you, it just wasn't like that. And they were only taking like 15, 20 people. So it was hard. And most of the people that got preference were like 18-year-olds, younger people. It was rare that they chose someone that was older. So it was kind of rough. I was a lot of praying going on, but I got in, and I had to make a choice, the more expensive school or the one that wasn't more expensive. And I did not know how I was going to pay for such an expensive school. But my mom was like, I think you should really take Emory because the name alone, having that name alone and graduating from that caliber of school would be really good for you. And I was like, well, I don't really care about that. I just want to be able to get a job and work, and I don't want to come out of school with a lot of debt. And so I worked for the year I had to wait. Still a year. I got accepted. I took Emory, and I worked and drove trucks for FedEx. I had a CDL already, so I drove like the big bus to the federal government building because I didn't have any charges of any kind of charges on my driving record, and I had a clean record. So I had that route because you have to pass all kind of clearances to drive the FedEx truck into the government buildings and stuff like that. I don't know what was in that truck, but I drove that big old truck and backed it up, and they took whatever it was out of there every day. So it was a pretty easy job. You just drive all day. I liked it. I could have seen myself doing that. It was a really cool job. One of the coolest jobs. Like if I had started at high school, but my mom wasn't having it. She was like, you going to school. So I was going to school whether I wanted to drive trucks or not. She just wasn't having it. She was like, you can drive trucks later, but you're going to go to school. And then you can go back and drive trucks. So I drove trucks for a year for FedEx, and I saved all of my money. I moved back home. I saved all of my money. So the first year I went to school, I did financial aid. I wrote essays for scholarships. I found scholarships like $1,000 here, $500 here, $1,000 here. And there were different need-based grants because radiology was a need-based field. The state, if you worked for them after you graduated for full-time for a year, that would pay back a year worth of school. So I got that grant as well. And I came out of that school with very little debt. I did come out with debt, but nothing like some of the other people in my, like, they could have bought some houses with the kind of debt they I was like, at the end of the year, I was like, oh my goodness. So I made it through school without a lot of debt. And I left school with a CT certification. Well, that's how I went straight into CT. So as soon as I finished school, my first year, we have a certain amount of exams you have to get done in your 2 years. Well, I did those exams in 1 year. I'm gonna tell you, when you're motivated and you're older, you know you don't have time to mess around. So I was like, I knew I didn't want to do x-ray. I did not want to shoot portables. I did not want to go to the OR. I could have done the fluoro. I did like the fluoro. And regular x-ray was fine, but I did not want to do those portables. I know my body would not have held up long doing portables every day, all day. And that OR with lead on your back, you have to wear a full body of lead. Yeah, I would have passed out holding up all that lead all day. A lot of back problems there. Yeah, so I just be honest with yourself and know what you were doing, what you want. And so I got all of my exams for those 2 years done in that first year. And my second year, I just decided to rotate through every modality that hospital had. Emory owned a lot of different hospitals, so I rotated through ultrasound, and I fell asleep in the room. Knew that wasn't for me. Can't fall asleep while you're ultrasounding the patient. So it's dark in there, and everything looks fuzzy on the screen. I don't know how they see what they see. I still cannot understand ultrasound. My eyes just can't see it. I never can even pick out a baby unless it's a 3D baby. That's how bad I am with ultrasound. So I guess your eyes get used to it, because people tell me the same thing about MR and CT. Like, how do you see that? So I rotated through that. I did radiation therapy. I really, really wanted radiation therapy. But as we talk later, nobody leaves that job. That's a job that people get into and they don't leave until they expire from the earth, literally. They do not leave that job. I'm telling you, it's a really good job. You get attached to your patients. It's really cool. You get the same people for about 6 to 8 weeks of their treatment. It was I think I rotated through there for about a few months. I love that. Then I rotated through nuclear medicine. It was cool. That would have been my second choice, but that was another year in school. And remember, I was a little older and I had gotten married by this time. I got married in my second year of radiology school. Yeah, that's another story time. That's another story time. Like, yeah, that was really interesting. So I'll wait till he's here because I'm sure we have 2 different stories on that. But yeah, so I rotated through, what else? CT, MR. MR was very, very cliquish. So yeah, I rotated, but they weren't very welcoming. So I did not want any drama. I didn't want to go somewhere I wasn't welcome. So I said, this is not for me either. Even though I liked MRI, the people did not welcome me well. So I was like, you know what? I'm not for the drama. And it seems like every place I went with MRI, it was a little extra. So I was like, yeah, no, not my kind. And, you know, so I went over to CT and they welcomed me with open arms. It was just lovely. Lovely, lovely, lovely. And I enjoyed CT. I still do it to this day. I learned a lot of skills in CT. I learned my IV skills there. I worked at a cancer center because of CT for a little over a year. That was excellent. And then I got a management job at a urology office. Amazing, amazing, amazing. They were my alumni from Emory University. Amazing doctors, some of the best urologists, people and doctors, I will say, and not just because I worked for them, but I learned a lot. So I worked in urology. I've done a lot of different things in my career. I'm grateful for. I worked to orthopedics. Well, that was when I got to MRI. That's a whole nother one. But yeah, so I did CT. And then after doing CT for a while and working all kind of different shifts, and CT started getting busier and busier and busier and busier and busier. Did I stress that enough? They were ordering CTs. Like if I worked a shift, oh my goodness, they would order CTs like somebody was giving away free CTs. It became so ridiculous. If your ear hurts, you got a CT of your foot. It was crazy. So, you know, if you're working by yourself and you're trying to pull dead weight over, I was like, man, yeah, my body, it was almost like x-ray again. I was like, yeah, my body won't last too long doing this. So yeah, I got to figure out something else. So the job I was at, they said I had 30 days to learn MRI, which was a joke. So all of my training was on OJT, on the job training. But when people give you a challenge, I accept a challenge. And I accepted that challenge and I did a lot of praying again. And I actually learned it in 30 days, enough to scan. Now, I didn't know what I was doing. I didn't know why I was scanning something. I literally was a button pusher at that time. So if you'd have called me a button pusher then, you would have been right. I was a button pusher when I first started MR. And the only education I had in it was reading the review book for the exam, because now I had to pass this exam because you have a certain amount of exams you have to get. They're only good for 2 years. So I had to pass this registry, and that was the hardest registry I have ever taken in my life. And now people have to take it over again. I'm so glad I took that thing back then. Oh my goodness. I couldn't imagine taking it again every 10 years. There's no way. Well, I can't say there's no way, but I would not want to. So I did pass it on my second try. My first try was a no-go. That's another story. So come back, because that is rather funny how I did not pass my first one. It's almost, I hate to use the word dumb, but it's actually just funny. But oh my goodness, it's embarrassing. So embarrassing. So make sure you turn your notifications on if you have not already, because that story time is coming and you don't want to miss it. And yeah, so that's how I became an MRI, CT, X-ray technologist. So if you enjoyed this 20 minutes that I've been just running my mouth, I am going to, with my husband, the other radiology guru, I'm pointing like he's over here. He's not, you guys. But he's going to be here with us, and we are going to tell this story together, and we are going to enlighten you, answer your questions about radiology, because it's an amazing field, amazing people. We do a lot for the healthcare field, and we're one of those modalities or healthcare professions that nobody knows about unless you watch ER, and they're always in the ER talking about call radiology. They're supposed to be down here. Where is radiology? Get radiology down here now. That is not the truth. We're always in the ER. Come on, you guys. I should be on one of these TV shows as the help for them to know how to get it right. So if you're out there listening, y'all, I can help you out. Reach out to me. You can email me. CNC Imaging Services. Yeah, I can help you. I do all of that. I can help you get your storyline correct, because there are so many medical professionals out there. It's not just nurses and doctors. And you all should know that there are other professions you can go into that are a lot of fun. You get to help a lot of people. You get to make a nice salary, and you get to you get to have flexibility in your schedule. And that is what we wanted to show you all, because what is life without enjoying it? And you also want to be able to do more than just pay your bills. So enjoy. Make sure you turn on your notifications, subscribe if you haven't subscribed, and give me a thumbs up if you thought this was at least a little bit entertaining or brought value to you some kind of way. And share if you would like. But see you next time.